Good day, ma'am. I am Micro B. Tapales. B is Criminology 1 Bravo. In this video, I'm going to discuss the artificial and natural methods of contraceptives. Natural and artificial methods of contraceptives. First is the abstinence. This natural method involves refraining from sexual intercourse and is the most effective natural birth control and method with ideally 0% fail rate. It is the most effective way to avoid STIs, sexually transmitted infections, and most people find it difficult to comply with abstinence, so only few use this method. Next is the calendar method. This method is also called as the rhythm method. It entails withholding from coitus during the days that the woman is fertile. According to the menstrual cycle, the woman is likely to conceive 3 or 4 days to record her menstrual cycle for 6 months in order to calculate the woman's safe days to prevent conception. So this is the image of an example of the calendar method. Basal body temperature. The basal body temperature or BBT indicates the woman's temperature at rest. Before the day of ovulation and during ovulation, BBT falls at 0.5 degree Fahrenheit. It increases to a full degree because of progesterone and maintains its level throughout the menstrual cycle. The woman must record her temperature every morning before any activity. A slight decrease in the basal body temperature followed by a gradual increase in the basal body temperature can be a sign that woman has ovulated. So this is the an image and example of basal body temperature or BBT. Next is cervical mucus method. The change in cervical mucus during ovulation is the basis for this method. During ovulation, the cervical mucus is copious, thin and watery. It also exhibits the property of spin bark kit wherein it can be stretched up until at least 1 inch and slippery. This is an example of cervical mucus method. Next is symptothermal method, a combination of the BBT method and the cervical mucus method. The woman records her temperature every morning and also takes note of changes in her cervical mucus. She should abstain from coitus 3 days after a rise in her temperature or on the 4th day after the peak of mucus change. This is an example of symptothermal method. Next is the ovulation detection. The ovulation detection method uses an over-the-counter kit that requires the urine sample of the woman. The kit can predict ovulation through the surge of luteinizing hormone that happens 12 to 24 hours before ovulation. Next is coitus interruptus, one of the oldest methods that prevents conception. A couple still goes on that coitus but the man withdraws the moment he ejaculates to emit the spermatozoa outside of the female reproductive organ. A disadvantage of this method is pre-ejaculation fluid that contains a few spermatozoa that may cause fertilization. Now let's proceed to the artificial method. First is oral contraceptives. Known as the pill, oral contraceptives contain synthetic estrogen and progesterone. Estrogen suppresses the follicle stimulating hormone or FSH and LH to prevent ovulation. Progesterone decreases the permeability of the cervical mucus to limit the sperm access to the ova. It is suggested that the woman takes the first pill on the first Sunday after the beginning of a menstrual flow, or as soon as it is prescribed by the doctor. So this is an image of an oral contraceptives. Next is transdermal patch. The transdermal patch contains both estrogen and progesterone. The woman should apply one patch every week of 3 weeks on the following areas: upper outer arm, upper torso, abdomen, or buttocks. At the fourth week, no patch is applied because the menstrual flow would then occur. This is an image of transdermal patches and how to apply them. Vaginal ring. It releases a combination of estrogen and progesterone and it surrounds the cervix. This silicone ring is inserted into the female reproductive organ and remains there for 3 weeks and then removed on the fourth weeks. As menstrual flow would occur, the woman becomes fertile as soon as the ring removed. So this is an image of the vaginal ring. Next is subdermal implants. Are two rod-like implants inserted under the skin of the female during her menses or on the seventh day of her menstruation to make sure that she will not get pregnant. The implants are made with eston, estonpegestrel, disogestrel, and progestin and can be helpful for 3 to 5 years. So this is an image of subdermal implants. Hormonal injection contains medroxyprogesterone, a progesterone, and is usually given once every 12 weeks intramuscularly. The injection causes changes in the endometrium and cervical mucus and can help prevent ovulation. So this is an estrogen progesterone hormonal injections. Intrauterine device, also known as IUD. IUD is a small T-shaped object containing progesterone that is inserted into the uterus via the female reproductive organ. It prevents fertilization by creating a local sterile inflammatory condition to prevent implantation of the zygote. The IUD is fitted only by the physician and inserted after the woman's menstrual flow. So this is the image of IUD. Chemical barriers. Chemical barriers such as spermicide vaginal gel and creams, and glycerin films are used to cause the death of sperms because they can enter the cervix and to lower the pH level of the female reproductive organ. So, it will not become conductive for the sperm. These chemical barriers cannot prevent sexually transmitted infections. Diaphragm. It is a circular rubber disc that fits the cervix and should be placed before coitus. Diaphragm works by inhibiting the entrance of the sperm into the female reproductive organ, and it works better than when used together with a spermicide cream. Excuse me. The diaphragm should be fitted only by the physician and should remain in place for 6 hours after coitus. So this is an image of contraception diaphragm or contraceptions of diaphragm. Next is the cervical cap. It is made of soft rubber and fitted on the rim of the cervix. It is shaped like a thimble with a thin rim and could stay in a place for not more than 48 hours. So this is an image of cervical cap for birth control care instructions. Male condoms. It is a latex or synthetic rubber sheet that is placed on the erect male reproductive organ before penetration into the female reproductive organ to trap the sperm during ejaculation. It can prevent STI, sexually transmitted infection, and can be brought over the counter. Male condoms have an ideal fill rate of 2% and a typical fill rate of 15% due to a break in the sheet's integrity, spilling of semen. So this is an image of male condoms. Next is the female condoms. These are made up of latex rubber sheets that are pre-lubricated with spermicide. They are usually bound by two rings. The outer ring is first inserted against the opening of the female reproductive organ, and the inner ring covers the cervix. It is used to prevent fertilization of the egg by the sperm cell. So this is an image of female condoms and how to use it. Next is the surgical methods. Surgical methods in men. A small incision is made on each side of the scrotum. The vas deferens is then tied, cauterized, cut, or plugged to block passage of the sperm. The patient is advised to use a backup contraceptive methods until two negative sperm count results are recorded because the sperm could remain viable in the vas deferens for 6 months. This is an image of surgical method for men. Next is in women. In women, the tubal ligation is performed after menstruation and before ovulation. The procedure is done through a small incision under the women's umbilicus that targets the fallopian tube for cathing, cauterizing, or blocking to inhibit the passage of both the sperm of the ovum. And this is an image of surgical methods for women.